Welcome to the Totally Adequate podcast, produced by Quest Analytics. Here, we dive into the latest news, policies, and innovations in healthcare provider network management with industry leaders who are shaping the future of care. Our mission? To elevate community health across the nation through superior provider networks.
Hey everyone, and welcome to the Totally Adequate podcast, the healthcare policy update segment. I'm Kate Dieters, and today we are diving into the latest and greatest in the federal proposed and final rules around network adequacy and provider directory accuracy. Joining me today is Zach Snyder, VP of Government Affairs at Quest Analytics, and he is here to help us break down what does everybody need to know and what's changing and what are some ways that you can start preparing for these changes. Hey, Zach, it's great to have you here. Thank you so much.
Yeah, thanks, Kate. And I'm happy to dive into all of the network adequacy and provider directory items that we have been seeing over the past several months. There is quite a bit of action.
Let's start by discussing the proposed rule for the notice of benefit and payment parameters, as well as the draft letter to issuers for plan year 2026. That is a lot to say. Now, these documents are very crucial, but some of our listeners may not be completely familiar with them. Zach, would you mind giving a quick overview of what they entail and why they're important?
Yeah, it is a bit of an alphabet soup, as it always is in healthcare. But on an annual basis, CMS does issue its notice of benefit and payment parameters and its draft letter to issuers that describes the requirements that the health plans need to meet in order to operate on the federal exchange for that year. CMS in 2025, in their notice of benefit and payment parameters rule, required state-based exchanges. So rather than placing requirements directly on the health plans in 2025, CMS jumped out of their usual role and placed a new requirement on state-based exchanges as it relates to network adequacy. They required state-based exchanges to adopt the same or similar network adequacy standards that they have for the federal exchange. In this year's proposed notice of benefit and payment parameters for 2026, they are reiterating that commitment. They're still requiring the states to do that, and they have until 2026 to actually have these standards in place. But they've placed even more requirements on both the health plans in the exchange and on states in their draft 2026 notice of benefit and payment parameters.
It sounds like there's a strategic shift to standardize network adequacy across the federal and state-based exchanges, something that we'll continue to keep our eye on. And regarding the new proposed rules, Zach, what specifically are they proposing to change for network adequacy standards?
Well, there's a lot in there. Like I said, they're continuing to require the states adopt the same or similar standards. But they also announced that they're adopting a new calculation for time and distance for health plans on the federal exchange. And that calculation they're calling geographic distance. It operates more similar to the way Google Maps operates. So they're using a new calculation that would take into account topographical features like large bodies of water, swamps, rivers, mountainous regions, so that consumers have a more accurate portrayal of what it would actually be like to get to a provider in their network.
Great. So it sounds like CMS and SSIO are wanting more information about what's really happening in that landscape to be able to help understand whether the plan really meets network adequacy and helping them with their network justifications and network exception process. Fantastic. Zach, is this something that you've spoken to other states about?
We have spoken to some states about geographic distance calculations, and what we see is that many states already use a calculation like this. So this would be an indication of CMS taking some best practices from the states and bringing it to a federal level. Now, the 2026 NBPP did not require the state-based exchanges to use geographic distance yet. They're going to be implementing that on the federal exchange. But as we have seen, as the years go on, they tend to take some of the things that they're doing at the federal level and then require the states to do the same thing down the road. That's exactly what they did with the requirement that every state adopt the same or similar network adequacy standards.
Okay, so some of the states have already been moving towards this way. And you read my mind, Zach. I was going to ask, is this something that the state-based exchanges also need to implement? And it sounds like that decision is still possibly to come, but is probably something that our listeners should at least be keeping in mind if they are on one of those state-based exchanges.
Yeah, yeah, and I'll add to that. When we look around every single state and what their current standards are for the QHP market, we see that states are really all over the place. There are some states that have today very similar standards to CMS. There are states that have standards that are slightly similar, that you could see that there's some alignment between the federal government and between the state. And there's some states that have really no standards or standards that do not look anything like the federal standards. So states will have to make a decision. Do we align our standards to meet the requirements, or do we apply for a waiver from CMS to state that we're not moving forward with aligning standards, but we believe that our current standards are comprehensive and meet the needs of consumers in the state? We don't know what CMS will do with these waiver requests, but we do know some states will likely ask for a waiver. And through our experience in talking with states and looking at what states are doing, we're already seeing states propose regulations to move their network adequacy standards to a more federal style standard. For example, the state of Nevada just a few days ago issued a proposed notice that they intend to move their standards to something that looks very similar to what the federal government has in place today.
It definitely will be something that will be interesting to keep an eye on as we move towards 2025. And Zach, do you expect to see states continuing to move towards this process, towards these standards in 2025 and throughout the year?
I do. I do expect to see that. States will have to make a lot of different decisions. There will be some state departments of insurance because those are the entities that usually set the standards. So there will be some state departments of insurance that have the existing legal authority to simply write rules or create guidance to implement the standards. But there are some states that they have the belief that they might need legislative authority to do this. And so when the state legislative session starts in 2025, there will be new legislation proposed that will then give the authority to the department to create the new standards. So there will be multiple pathways to implementing these standards, and I expect to see lots of new guidance, regulations, and proposed legislation in 2025 to meet this 2026 deadline.
It will be a busy year, and it sounds like there will be possibly a lot of movement that we're all going to be looking for. Zach, what are some predictions that you have as we move into the next year?
On the network adequacy side, we know that CMS has a strong commitment to incorporating health equity considerations into every single new policy or regulation that they do. I attended a conference of CMS and other leaders to discuss health equity just yesterday. And in that meeting, they reiterated their commitment to an executive order that was signed by the president that required all agencies to incorporate equity into their rulemaking process. CMS is using that executive order and they're really running with it to incorporate health equity considerations into everything that they do. So we could potentially see CMS incorporate new health equity considerations into network adequacy policy as the years go on. They're doing this already in other areas, so I would expect them to at least evaluate the possibility of bringing in standards to current network adequacy. And that could include simply bringing it a requirement for health plans to measure and monitor access to health provider types that are critical to meeting the health equity needs of the population. So think about language and things of that nature that would really drive the ball forward in terms of getting people more relevant care and ultimately bringing them to a healthier state. And that is the goal of health equity from CMS's perspective. It's how can we put policies in place to ensure the same level of health regardless of what situation you were born into? And it is a laudable goal.
Health equity has been a big topic now for a couple of years. So we'll definitely keep an eye on it as they continue to look to bring it in more into network adequacy. And the takeaway I have, Zach, is that regulators, regardless of it's at the federal or at the state level, they're really looking to have more transparency into the health plan's data. And they want to be able to see, is that provider really at that location? Are they actively seeing patients on a regular basis? Is that something that you're seeing as well or hearing about as well in your conversations with them?
Across the board, yes. Regulators at both the state and federal level are requiring health plans to provide more and more information to them about the nature of their networks. And on the provider data accuracy side, yes, more requirements to ensure that the provider data that they're putting in their provider directories are true. We've seen all of the headlines about ghost networks where someone sees a provider that they want to connect with in their provider directory and they call the provider, but the phone number has changed, or the provider doesn't have the specialty that was displayed on the provider directory, or some other issue with contacting the provider. And that's a huge problem. We want to make sure that the provider networks and the directories that are given to the consumer or the patient will actually connect that individual with care.
With the increased requirements in the draft for 2026, what is a takeaway or piece of advice that you have for our audience listening here to prepare for these new rules?
I would talk with my network team to understand, are we prepared to implement societal-like standards in the state-based exchange states? That's where everything's moving.
Yep.
The other question I would ask is, what methodology of measurement are we using to measure between our providers and our members? CMS is a first mover, not really a first mover, as I said, some states are using this, but at a national level, a first mover in using geographic distance. That seems to be the future, bringing a more Google Maps-like experience to measuring time and distance. I would also ask about that and understand, are you prepared to implement something like that across all lines of business potentially moving forward?
Fantastic. So moving right along to the Medicaid side of the house. I don't know why I call it the side of the house, but so the Medicaid landscape, I hear there is a final rule released there as well. Zach, can you give us a bit of an overview of what that entails regarding provider data accuracy?
Similar to what I said on the QHP side, where on an annual basis, CMS releases a rule that lays out exactly what the health plans need to do in order to become certified as a QHP on the federal exchange. On an annual basis, CMS releases a rule that places new requirements on managed care programs on the states as they implement their own state-based Medicaid program. In the latest managed care rule that was issued this year, there were new requirements placed on states to implement programs to ensure that the managed care organizations, the MCOs, the health plans, have processes in place to ensure accurate provider data. That process includes requiring the MCOs to reach out at a regular basis to their providers to ensure the accuracy of various data fields, including provider name, provider address, provider specialty. And CMS said that states can place even more requirements on the MCOs. So every state might have a different data element, but there is a floor level of data elements that all states will need to implement. And this is similar to what we saw on the commercial side with the No Surprises Act, where health plans are required every 90 days to proactively verify the accuracy of provider data information. It's bringing that requirement over to the Medicaid side of the house, as you put it, Kate, and a way to ensure alignment across lines of business.
Sounds like there will be a big change coming their way. What is one recommendation you have for someone who is trying to prepare for these changes?
Well, there's a lot of changes. The network adequacy and provider directory requirements that I described with the managed care rule are just one element in that very giant rule. I would get together with my provider data team and understand our process of how we proactively outreach to providers to verify the accuracy of information, what that cadence looks like. Are we prepared to do that for the Medicaid line of business? You're probably already doing it for your commercial lines of business. Are you prepared to do it for your Medicaid line of business? How do we work that in? And that will help you feel more comfortable and confident as more and more states will implement these requirements. You may not have seen this in your state yet because CMS has given states until 2027 or 2028 to comply. And states, they will announce how they're going to comply with that through a variety of avenues, which could include amendments to the MCO contracts that you hold, that MCOs rather hold with the state. It could come in the form of new guidance, new regulations, and even new statutes that come into play. So we're going to see likely lots of activity in 2025 and 2026 as states gear up to comply with these new provider data accuracy requirements that go live in 2027 for some states and in 2028 for other states.
You mentioned contracts, and it makes me think of all of the different Medicaid contracts that are out there. One, it seems that in the last year, with a lot of these changes to network adequacy, provider data accuracy, there's been a handful of states that have said, okay, we did release these RFP bids, but hold on, we're going to now take these contracts back and we're going to put out a new RFP. Have you seen that as well?
Some states have a regular RFP calendar where they issue RFPs for new managed care plans on a predictable time frame. Other states, they do an ad hoc RFP process where when they feel like they need new requirements or new MCOs, they will issue an RFP. Other states don't even do a RFP process. They seek out the MCOs on their own and enter into contracts with them. It's normal when these new contracts come out that they will contain provisions that we haven't seen forward because states want to continue to innovate and they also want to continue to achieve compliance with CMS standards, which are always changing. So for the states that are issuing new RFPs in 2025, we do expect to see new network standards. In 2024, for example, CMS did require every state to implement what they call EQRO Protocol 4, and that's the External Quality Review Protocol 4, and where they have or require their EQROs to conduct network adequacy validations of all the MCOs starting in 2024. So they're doing that. That could drive different changes in the contracts that the MCOs have with the states. So we do see many changes as it relates to network adequacy and provider directory accuracy as these new RFPs drop and new contracts drop from the states.
Excellent. Yeah, something that plans definitely want to be aware of when they are submitting for those bids. All right, Zach, we are moving on to our next rule. We are going to be discussing mental health parity. This is another one that has been out there for the last couple of years. There's been conversations back and forth, and they just recently, in the last couple of months, released their final rule. Can you give us an overview on this one as well? What does it include?
Yeah, a long-awaited final rule implementing the Mental Health Parity Act was finalized this year. The industry was watching this. This is a tri-department rule. So 3 departments work together on this rule because the rule impacts both the types of plans that are covered by CMS and the types of plans that are self-funded plans that are regulated by the Department of Labor. The 3 agencies were HHS, which is the parent agency of CMS, the Health and Human Services Department, the Department of Labor, that oversees self-funded plans under ERISA, and the Treasury, which oversees the IRS because there's actually tax implications in this new regulation as well. So these three agencies issued a final rule together. And in the final rule, they address how payers and plans approach comparative analysis of non-quantitative treatment limitations. As the final rule states, every plan will have to enumerate all of their non-quantitative treatment limitations and do a comparative analysis of these NQTLs, as they call them. One of the major NQTLs is network admission and network adequacy. And in the section related to that, the departments announced that they are requiring self-funded payers to collect time and distance information. This is the very first time we've seen any time and distance network adequacy requirement placed on self-funded payers. We've seen a lot of requirements placed on fully insured payers and the states and through what CMS has done. And even on the Medicaid and the Medicare side, we've seen a lot of requirements there. This is the first time we've seen time and distance requirements, any time and distance requirements placed on self-funded payers in the final rule issued by the tri-agencies.
Well, that one is definitely a lot for someone to digest. So thank you for breaking it down, Zach. If someone is preparing for these changes, is there one piece of advice that you have for them?
The piece of advice that I think is most relevant to network adequacy as it relates to the mental health parity final rule is to, number one, wait for new technical guidance to come out. The departments recognize in announcing their final rule that they haven't provided enough detail for plans to fully implement the requirement that they track and implement time and distance metrics. They announced that they're going to finalize technical guidance that will give payers more information about exactly what the departments are looking for as it relates to time and distance metrics. If I'm a payer or a health plan, I would begin to ask myself, do I currently collect time and distance information for my self-funded plans? Or if you're a self-funded payer, do I collect this information today? Am I prepared to collect time and distance data about mental health providers and compare them to how you do it with your physical health providers? What tools are you using? How are you doing that today? And that will at least begin the conversation and put you in a good place to begin implementing the requirements when the technical guidance is finally issued.
Well, more to come. You'll have to keep an eye out for that technical guidance. All right. And last item on our docket, Zach, is the National Directory pilot that CMS recently announced.
Did announce a national directory pilot, a national provider directory that will serve as a source of truth to ensure that health plans can use one data set to populate their provider directory that is as accurate as you can possibly get it. They issued an RFI last year announcing that they wanted to do this. However, now they've launched a pilot in one state, in Oklahoma, to see if they can pull it off in one state. If they can pull it off in one state, perhaps they bring this idea to the rest of the country through a national provider database that will serve as a source of truth for the purposes of provider directory accuracy.
Well, health plans have been asking for something similar to this. Zach, what would you say is one of their ultimate goals that they're trying to achieve with this pilot?
Well, they announced that they're trying to achieve a greater fidelity of provider data accuracy for the entire industry. They recognize the issue of ghost networks. Senator Ron Wyden, who is the chairman of the Senate Finance Committee that oversees all legislation relating to Medicare Advantage, moves through his committee. Ghost networks has been one of his major priorities. He's proposed legislation both this year and last year and has held hearings on ghost networks and has even had his staff produce reports on ghost networks. He has announced and produced a letter and sent that to CMS saying that the efforts that CMS are undertaking with looking at this national provider directory are aligned with his goals of reducing ghost networks. So if you look at it through the lens of one of the most prominent United States senators voicing support for CMS and its a walk down a path of implementing a national provider database, you could come to the conclusion that this national provider database is designed to address the issue of ghost networks as well.
Is there anything you believe our audience should be aware of or should be discussing with teams within their organization regarding this pilot?
Well, I think plans should pay attention to what CMS does here. I think it also serves as a good opportunity to bring groups of subject matter experts at your plan together to understand what your provider directory accuracy program looks like internally. How are you ensuring that you have the most accurate information available for your providers? And think about, do you want to provide input to CMS on how they're running their pilot? You'll have an opportunity to do that through your industry trade associations or on your own as a health plan with experience trying to ensure the most accurate provider data possible.
Yes, they say they love to hear from everybody, and the best way to do that is by submitting comments during their comment period. They want to know, what do you think is working, what's not working, and the comment period is a fantastic time to do that. So we hope you all submit your thoughts and comments to them around this pilot. Zach, as always, this has been so helpful. Are there any other final thoughts that you have or anything else that you'd like to share?
Well, I'd like to ask the audience watching to continue to tune in and understand the latest in network adequacy and provider directory accuracy from Quest Analytics. We pay attention to everything going on across the country, across all 50 states as it relates to network adequacy issues. You can view us as a complement to the work that your teams are doing, the work that your industry trade groups are doing. We go very deep into these issues and are always happy to partner with health plans and with anyone to make sense of all these regulations and how to best implement them with you and your teams.
Fantastic. Yes. I hope that you come back for next month's session. And Zach, thanks again for being here today in the studio to help us break down all of the rules and really help our audience understand what should they be focusing on, how can they be preparing for these changes. We know that there's a lot. So your advice and your insight is extremely helpful. And we can't wait to have you back next time to talk about any of the other updates that we have. So thank you so much. And thank you to all of you who are listening to this episode of the Totally Adequate podcast. We really appreciate you being a part of this community, and we hope you leave us a review, comment, share, follow us. We'd love to keep the conversation going. So thanks again, and hope you have a wonderful day.
Thank you for tuning in to this episode of the Totally Adequate podcast. If you enjoyed it, we'd appreciate it if you could rate us on Spotify or leave a review on your preferred podcast platform. Your feedback helps us grow and bring you even better content. We also invite you to send us any comments or topic ideas by emailing us at thetotallyadequatepodcast@questanalytics.com. The Totally Adequate podcast is produced by Fowler House Films and Quest Analytics. Thank you for listening.